Hey everyone, I'm going to try something new today. This is going to be a case walkthrough of a specific patient that I've had on the table. And if it's a success, I'll keep doing these case walkthroughs to help you look at a patient and go through the thought process of what to do. So let's dive right into it. I have some pictures here that I want to share. So a good thing is to always take clinical photos of your patients because it serves well for client communication. It's really helpful to be able to show the owner what you are actually finding. So if we have a look at this picture, you can see here that there is a significant amount of gingivitis. So this is the red line here. This is not supposed to be red. And you can see there's also a significant amount of calculus. And this is kind of a grade 3 calculus because it's covering more than 2/3 of the crown here. And you also notice some bleeding even before I touch the gums or everything. There is bleeding. This is a sign of severe periodontitis. Also, when you look at the teeth, you can notice the brown discoloration right here. This is because of tooth wear. So it could be attrition, tooth on tooth contact, which is not really possible in this area, or it could be abrasion, which is tooth on a ball, B for ball, abrasion, like a tennis ball or rocks or something that smooths this tooth down and grinds it down. Let's take a look at some other pictures. You can see here when you do your oral examination, you have to check all surface of the teeth, and this is a lingual view of, this is 4010, and you can see there's some bleeding here in this diastema. So we're going to have a look at this a little bit later. If you have a look at right here, these are the incisors. This is right after some probing. I only did some probing with the periodontal probe, and when you see bleeding like this, you have to mark G2 on your dental chart, which means gingivitis grade 2, because it's bleeding. And if it's bleeding on probing, then you have disease. You have gingivitis and possibly also periodontitis. And you can see right here, there's some gray stuff coming out, and here, and this is pus. So when you have bleeding and pus, most likely you're going to have to extract these teeth or do a root planing where you go down and clean the roots, have the owner do home care and brush, and you can also do guided tissue regeneration. But you know, if the owner let the situation come all the way to this, it's oftentimes very hard to get it back into normal condition, because it's a sign that these owners are probably not going to brush every day to keep it very clean. So, and you can see right here, there is also a palatal defect, so a palatal pocket right here with some attachment loss. There's going to be calculus down here and lots of pus. These are quite forgiving actually. You can, in many cases, if there's not yet an oral nasal fistula, then you can go down and do open root planing. So you take your curette and you scrape all of this calculus and diseased tissue out of this pocket. Then you can place, depending on what it looks like, but in many cases you can place a bone graft like a Periomix, and then you can add some hyaluronic acid, you can add some PRF, and then a membrane on top. This could be a collagen membrane. It could be a new thing that's working in humans is magnesium membrane that dissolves by itself. And so that's very interesting. And there's also studies showing that you can use just hyaluronic acid and bone graft, and then you don't need a membrane. But the gold standard is to put a membrane on top of that. What I wanted to say is that if you have a palatal defect, there is a chance you may be able to save it, even if the owner is not going to brush every day. So just a consideration. All right, so let's go through some of these x-rays to see what they actually look like. So the first view here, you can see I'm paying a lot of attention to this area right here. because you can see there's a dark area between 109 and 110, and this is bone loss. So this is absolutely abnormal, this amount of bone loss right here. I'm also concerned about the furcation area right here. There's also a darkened area, so I'm concerned about furcation exposure. When you look at these teeth, these look quite normal. There's maybe slight bone loss here. Apart from that, it looks okay. And here, the incisor, this looks okay right here. And you can see that actually there's not a lot of bone loss on the x-ray. So with this bleeding that we saw before, we're gonna have to take a closer look when we do the cleaning and we do the curettage, so we root planing, scrape out the pockets, see what's in there, see how deep they are, and so on. So we'll see, but remember this, x-rays, they underestimate bone loss because you have to have a 40% demineralization of the bone before you can see it on x-ray. So just remember that x-rays are always underestimating the amount of bone loss. So the other tooth here, the canine tooth looks all right. And the premolars here looks okay. I'm a little bit concerned here. Is there some bone loss right here? And then when you have a look at the oblique view, I use this a lot to check the 9 and the 10. And you can see still, again, we have this bone loss right here, this dark area. So most likely this tooth is gonna have to come out, this one. So if we look at the mandible, then we see we just cut off the 11. So we would want to take another photo here to make sure we check the entire tooth. Look at this area here. Do we have, let's see if I can zoom in. So what I notice is I notice some widening of the periodontal ligament space right here. It should be as thin as this part here, but you can see there's some widening of the periodontal ligament space, and there's also widening here, and some looks like some radiolucent area right here. So I would think that there's a pocket and possibly a little bit of mobility with this tooth just based on this x-ray alone. The other teeth, they look nice. There's nice bone up to the crowns here, so that's good. Also this picture, this was a canine picture, looks quite nice. Another canine picture, it was turned upside down, looks nice. Incisors, I don't see a lot of bone loss here, looks okay. Also maybe some bone loss right here in between the teeth. And these are the premolars. These look okay. Oops, and so you can see the bone height here looks all right. And then you come to this area, and this was the tooth we saw before on the clinical photos. And now you can see that this periodontal ligament space is very wide. So you have a triangle right here, going here, boom, boom, right here, where there's no bone, and there's going to be a deep pocket, and this tooth is going to be mobile for sure. This one's maybe a little bit of bone loss here, but this one is an extraction, absolutely. So we have this saying that, you know, if it's more than 50% bone loss, then you have to extract. And in this case, you measure from right here, just under the where the enamel stops, which is here. So you go down here, and then you measure from here to the apex, and that's 100%. So the bone loss goes all the way down to here. So this is more like 70% bone loss. So definitely an extraction of this tooth right here. And that's all the x-rays. So I hope this walkthrough was useful in how to look at dental x-rays, what to think about when you open the mouth in a dog, and look at the signs that you see. And I'm going to be making more of these cases, so write in the comments if you enjoyed this type of video, because then I know if it's valuable. And also write me what I should talk about next, because I want to make more of these talking videos where I go through cases and go through stuff. It can also be equipment or whatever you need. So let me know in the comments what you want me to make next, and I'll see you in the next video.